Hello everyone and welcome back to our channel. Today we're tackling a very serious topic, acute liver failure. It's a condition where your liver, an organ that does over 500 vital jobs, suddenly stops working. Unlike chronic liver failure, which happens over years, acute liver failure can develop in just days or weeks. It's a medical emergency that needs immediate care. So what should you be looking for? The first signs can be easy to miss because they're similar to other illnesses. You might feel generally unwell, tired, nauseous, or have diarrhea and discomfort in the upper right part of your belly. But as the condition progresses, the symptoms become much more alarming. One of the most classic signs is jaundice, where your skin and the whites of your eyes turn yellow. This happens because your liver can't process bilirubin, a yellow substance in your blood. You might also notice your abdomen swelling with fluid, a condition called ascites. Even more serious are the neurological symptoms. You might feel confused, disoriented, or extremely sleepy. This is called hepatic encephalopathy, and it happens when toxins that your liver would normally filter out build up and affect your brain. In severe cases, it can lead to a coma. Other warning signs include easy bruising or unusual bleeding because a failing liver can't produce the proteins needed for blood clotting. So, when is it time to see a doctor? Immediately. If you or someone you know suddenly develops yellowing of the skin or eyes, tenderness in the upper abdomen, or any changes in mental state like confusion or drowsiness, you need to seek emergency medical help right away. Acute liver failure is life-threatening, and every second counts. Don't wait to see if it gets better on its own. Now, let's talk about what causes this sudden and severe condition. The most common cause in many parts of the world, including the United States, is an overdose of acetaminophen, which is the active ingredient in Tylenol and many other over-the-counter and prescription pain relievers. It's crucial to follow the dosage instructions on these medications very carefully. Taking too much at once, or taking high doses over several days, can overwhelm and destroy your liver cells. Another major cause is viral hepatitis. Hepatitis A, B, and E can all lead to acute liver failure. While hepatitis A and E are usually spread through contaminated food or water and typically resolve on their own, they can, in rare cases, cause the liver to fail suddenly. Hepatitis B is more commonly associated with chronic liver disease, but it can also present as an acute, severe illness. Prescription medications are another potential culprit. Some antibiotics, anticonvulsants, and even certain non-steroidal anti-inflammatory drugs can cause what's called idiosyncratic drug-induced liver injury. This is an unpredictable reaction that isn't related to the dose. Herbal supplements can be risky too. Certain herbs like kava, ephedra, skullcap, and pennyroyal have been linked to severe liver damage. It's a powerful reminder to always talk to your doctor before starting any new supplement. What about toxins? The wild mushroom Amanita phalloides, also known as the death cap mushroom, is famously poisonous and causes devastating, often fatal, liver failure if eaten. Industrial chemicals like carbon tetrachloride can also cause acute liver damage. Autoimmune hepatitis is another cause, where your body's own immune system attacks your liver cells, causing inflammation and damage. And sometimes, diseases like Wilson's disease, a rare genetic disorder where copper builds up in your body, or Budd-Chiari syndrome, where veins draining the liver are blocked, can trigger acute failure. In many cases, though, doctors can't find a specific cause. The complications of acute liver failure are severe. One of the most dangerous is cerebral edema, which is excessive fluid buildup in the brain. This increases pressure inside the skull and can be fatal. Bleeding disorders are also common as the liver can't make clotting factors. This can lead to uncontrolled bleeding, especially in the gastrointestinal tract. Infections are a huge risk because the body's immune system is compromised, making patients susceptible to pneumonia and urinary tract infections. And finally, Kidney failure often follows liver failure in what's known as hepatorenal syndrome. Certain factors can increase your risk. Obviously, taking more than the recommended dose of acetaminophen is a big one. Having a pre-existing liver disease like chronic hepatitis B or fatty liver disease can make you more vulnerable. And of course, consuming things like wild mushrooms or certain herbal supplements puts you at high risk. When you get to the hospital, diagnosis will happen quickly. Doctors will use blood tests to check your liver function and your blood's ability to clot. They'll also test for viruses like hepatitis and for acetaminophen levels. An ultrasound or other imaging scans might be used to look at your liver and check for blockages or other abnormalities. In some cases, a liver biopsy where a tiny piece of liver tissue is removed for examination might be needed to help pinpoint the cause. Treatment for acute liver failure is done in the hospital, usually in the intensive care unit. The main goals are to support the body and give the liver a chance to heal, while also treating the underlying cause. If it's from an acetaminophen overdose, a medication called N-acetylcysteine can act as an antidote, but it needs to be given as soon as possible. For other causes like viral hepatitis, doctors might use antiviral medications. The focus is on managing complications. Medications can be used to reduce brain swelling. Blood products might be given to correct bleeding problems. And doctors will work hard to prevent and treat any infections. For many people, however, the liver damage is too severe to recover from. In these cases, a liver transplant is the only cure. Patients are placed on a high-priority transplant list, and the surgery can be life-saving. Now, a word on alternative medicine. While some people look to herbal remedies for liver health, when it comes to acute liver failure, no alternative treatments have been proven effective. In fact, as we discussed, some herbal products can actually cause liver damage. It's critical to rely on proven medical treatments in this emergency situation. So what can you do in terms of lifestyle and home remedies? The best approach is prevention. First and foremost, follow medication instructions carefully. Never take more acetaminophen than the label says, and be aware that it's in many different products. Avoid mixing it with alcohol. To prevent viral hepatitis, practice good hygiene, like washing your hands thoroughly, and get vaccinated for hepatitis A and B if you're at risk. Avoid risky behaviors that can spread hepatitis, and be extremely cautious with any herbal supplements, always discussing them with your doctor first. Finally, never ever eat wild mushrooms unless you are an absolute expert in identifying them. If you are struggling with alcohol use, which is a major cause of chronic liver disease, please know that help is available. Talk to your doctor or a mental health professional. There are resources and support systems that can guide you toward recovery. Your health is worth it. Acute liver failure is a frightening and fast-moving condition, but understanding the signs, causes, and the importance of immediate medical care can make all the difference. Taking preventive steps in your daily life is the best way to protect this incredibly important organ. Thank you so much for watching. We hope this information was helpful and empowering. If you found this video valuable, please give it a thumbs up and consider subscribing to our channel for more health content. Stay safe, and we'll see you in the next video.